So next on our sort of walk through the office is an actual walk through the office. What we're going to do is we're going to take a minute to walk through the office and you'll see some of the changes that you can expect to see and that our patients will see as they come in. And I walked you through some of those so you're aware of them. So when you walk up to Alligator Dental, you'll see some new signage at the beginning that relates to both the temperature checks of people and feeling ill, and then also some of the basic CDC guidelines for people to follow. I'll let you know that anyone that comes up and see this sign or that maybe doesn't meet the criteria is welcome to wait in their car, or someone who's unsure can also wait in their car. So we'll offer that as an option. Anyone who wishes to wait out there for the test and text them to come inside, all right? So for those who do come in, they'll come into the office. Follow me. Well, we have the last few touches still to put on things. You'll notice the front office is going to, and the waiting areas are going to look much more cleared out. You'll notice again we have additional signage available. We will have the clear plastic screens up for our front office and our receptionist areas. But you'll notice by and large there's going to be a lot less stuff around. Our magazines are gone, our toys are gone, some of those other activities. And what we've really done is we've tried to expand the concept into what we call family pods. And so when a family shows up, they'll come, they'll rush, they'll check in, and of course the first thing they'll do is their thermometer and their temperature check with everyone within the group. And then once they get kind of checked in and set up, a lot of the regular, normal Alligator Dental stuff will continue to happen. Their pictures taken, they'll be greeted, they'll do all the normal things we do, but then they will be assigned to one of the family pods. We're going to choose which one. And as you can see here in the Seguin office, we've set things up where we have 5 pods set up that are available. We have a movie pod, we have a pod that's inside of our arcade area, and then we've got a couple other ones all denoted by the blue tape on the floor. And you'll see that these are kind of areas sectioned and cordoned off so that people know appropriate social distancing and know where they can kind of be and hang out. And they'll remain in this space during their wait in the waiting area. Once they leave that space to come to the back, of course, they will, that area will then be disinfected by the front office staff, the team of the receptionist, and also our financial coordinator and our public relations director to ensure those areas stay clean in between patients, and they'll work in tandem to try and make sure those things happen. Once someone is called to the back, what they'll do is they'll come through. You'll notice our doors are propped open. One of the ways we're trying to help minimize the number of high contact surfaces is ensuring all doors that can be propped open are propped open. They'll come back to this area, and then you'll find the same thing in our clinical spaces. We have pods again. You notice we have the floor marked off for our x-ray area, our baby rooms, and then the hallways and other areas are denoted again by marks on the floor showing which pods are available, and a family will then be assigned to that clinical space or pod area where they will get all of their checkups, examinations, everything will be more or less done in those areas as best as possible. And it's up to our staff to really ensure that families stay within their little boundaries, and as you need to move to get x-rays, wherever it is, you kind of move as a group and as a team together to ensure things go well. So you'll see that we've got things marked on the floors around. As you also look around, and we come around through things, you'll notice a few other things. Our brush-up areas are going to be closed temporarily. There's going to be some signage there to note that we won't be using them for a period of time, which then means that our oral hygiene kits will be pre-packaged. We won't be taking the toothbrushes out. They'll be handed to the patients based on what color they wish, and then we'll be applying fluoride by other means. We'll probably actually be putting it on our fingers and just gently rubbing it on the teeth versus the toothbrushes, just again to help ensure we keep the amount of splatter, aerosols down within the office. As you come around again, you see the treatment rooms and other areas really have not changed much, but again, it's the floors that are denoted. And you'll see that we have chairs set up so there's many waiting areas throughout the clinical space. As you come through the clinic and eventually come around to the checkout area, again, you'll notice that we have social distancing marks on the floors to allow people to separate as needed to remind them of that. And then you'll see, again, throughout the office, and especially now in the front, we have places like this, a sanitation station where we encourage staff members and employees and family members to use these as frequently and as often as needed as possible. As they leave, as they come here, any place they come and touch, they can wipe down and they can be clean from there on, okay? So then as people leave the building, they'll go out the exit as they normally do. Again, we have a sanitation station right as they leave. We've also gone to the effort of rearranging our toys so that the packaged items, so any parent that's extra concerned can make sure to go to a packaged prize area where they know they're getting a prize that's inside a package and it's not just loose. So there's a few of the things you'll kind of notice throughout the office that we've done. If you have any questions about them, please let us know. But there's our office tour.